Hello, guys. Good day. This is Anne of Reinforce Me Club, your fellow positive reinforcer. Today, we are going to talk about key communication skills for nurses. So, this is not only for you and for the rest of the people, but also for me. I am not a perfect person, but I am a work in progress. I am not 100% all the time, but mind you, guys, I'm doing my best to improve communication wise, attitude wise, and work wise, for to improve the quality of work that I give to my patients. So, by the way, I am also a nurse and I am still currently working as a nurse. So, the purpose of this topic today is to enhance patient care and positive team dynamics among nurses by means of improving communication skills. And this is crucial at times, especially when things are hectic. But overall, when people know how to communicate effectively, then there are loads of benefits with good communication skills in a team, as well as in terms of the delivery of care that the nurses or healthcare providers give to patients. Now, today I am going to give you 7 strategies for improving communication skills. Number 1 is active listening. Not just listening in order to respond. Listen to understand. Pay full attention. Focus entirely on the speaker. And, when there's a lot of noises around, then take time to really listen to them closely, and as much as possible avoid interruptions or distractions. And when a speaker, or let's just a patient is talking, show engagement. Use nonverbal cues such as nodding, eye contact, and leaning forward, which means that you are interested about what the patient is going to say. And when you finally gather the information, reflect and clarify. Clarify so that you just in case if you got the wrong information, clarify so the patient can able to reiterate what he or she wants to say. Rephrase the speaker's words and ask questions to ensure understanding. So, active listening. 100% full attention to the speaker. Because sometimes, when we have loads of things to do, our mind could be all over the place. But we are physically, with the person talking to us. So, as much as possible, listen actively. Listen carefully to understand so that you can be understood too. You can understand each other. Number 2 is empathy and compassion. Understand emotions. Recognize and acknowledge the emotions of patients and colleagues. Some people could be anxious though. That could be intentionally or unintentionally, they don't know what they're doing. And to some point, it could piss you off because you know what's going to happen. Like, for example, you want to prevent injury, you want to prevent falls, but some patients should be like, they want to get up, they want to go home, and you have to be extra careful in handling these patients because you don't know what they're going through. And I also had an experience with this wherein we couldn't understand each other to the point that I need to call somebody to help me out, understand the patient, communicate with the patient. Well, to myself, I couldn't please people. There are people I couldn't understand, to be honest with you, in my entire career. I'm not 100% all the time, every day. There are people who cannot understand me. There are also people I couldn't understand. But the main thing is, I know deep down that if that situation pops up, like there could be misunderstanding, communication is the key. And always call somebody to help you out. in order to really save the relationship, save the patient. Because, when we're working as a healthcare provider, always patient first, whatever happens. Be an advocate, even if it's the end of the world. Be a patient advocate when you're working. So if you need somebody to help you out, to save the relationship, to keep the continuing care with the patient care, call a friend. And then, you know, when the time comes, if there is an opportunity to make it up to the patient, to really handle yourself the next time around, you encounter the same patient, or different patient, but the same personality, the same attributes, you know how to handle yourself well this time in a way that you can deliver an effective patient care. So, in other words, learn. If there are opportunities around to learn, keep learning. And you can also learn a lot from yourself. And speaking about empathy and compassion, yes, indeed, it's important to acknowledge the emotions of patients as well as your colleagues. When they're pissed off, even if you're pissed off, you have to get to the point. The common ground wherein you can understand each other and still deliver an effective care to get the job done effectively and efficiently. And when you are a kind of a healthcare provider or a nurse who is empathetic and compassionate, you can easily respond appropriately in a genuine way, genuine concern and understanding in your responses. And that will result to, a patient can trust you, can build rapport with the patient, and they can open up, they can trust you. Of course, that will also lead to a situation wherein a patient will cooperate with you. Yes, indeed, that is the key: cooperation, compliance, so that the patient can fully recover and be safe. So that's the goal: cooperation. Number 3, you have to communicate in a clear and concise manner. Avoid jargon, especially when you are at work. Use simple language, especially with patients who may not be familiar with medical terminologies. So, in speaking about medical terminologies, you can talk these terms to your colleagues, fellow nurses, or even to the doctors, medical jargons. But if there are things or issues or diagnosis, or let's just say, yeah, it could be diagnosis, or in a way that you have to explain the physiology of the body, how the body works, how the digestive system works. If there are ways that in which you can be understood by a patient, not who is not a medical expert, explain it in a simple manner, in a layman's term, shall we say, or explain it in a way that you are talking to a like let's just say 7-year-old kid, where you can make the issue understandable to the patient at their own level. I'm not saying that they're not capable, but some patients, or most of the patients, they're not medically knowledgeable. Knowledgeable in medical terms. It doesn't mean that they're not capable, but when you help them understand by means of good, simple, straightforward communication, in a way that you're talking to a young child, they can get what you mean to say. So avoid jargon, be specific, provide clear instruction and information, avoid ambiguity. So, or, people could be different. You can communicate to different people differently in their own way. So the same is true with, the love language. You must love the person in their own love language. And never forget that people are different, so as well as your patients. So you have to find a common ground so that the care will be effective. And never hesitate to call a friend if you can't make it. If you're if you're off your nerves, call a friend. Call your colleague to help you explain or give the care that the patient needs, because once again, patient is the priority, not your feelings, not your feelings as a nurse. Patient needs our care, so they are the priority. Although we're off balance at times because we could be pissed off or we're stressed out, so that is why we need our colleagues or somebody to help us out to continue the patient care. Number 4, be mindful with the nonverbal communication, like body language, facial expression, as well as the tone of voice. You know the way when someone is unapproachable, although they can tell you nice things, you can still say to yourself that they're not sincere enough about what you're saying because of their facial expression or the tone of their voice. And don't forget that we all have gut feeling, and we trust it. We trust our gut feeling. So in terms of body language, ensure that your body language is open and approachable. Otherwise, no matter how good you are in your communication, it still wouldn't work if you don't show it. You have to walk your talk and use facial expression to match your words and emotions. Be mindful to convey the appropriate message in your tonality. Sometimes you could be saying good things, but the tone of your voice could be like kind of upset. So be mindful also with the tone of your voice. Number 5, cultural competence. Respect diversity. Be aware of cultural differences and respect them in communications. So, like for example, though there could be differences with words though. Even in Ireland and the American English, they have differences, and that could lead to misunderstanding. Even with the ordinary English plus the Arabic, there are some terms in which you don't intentionally speak out, but it could mean something else to Arabic, to some Arab patients. So simple terms leads to misunderstanding. That's why you have to be careful with it. And if shit happens, be ready to make it up, to compromise. When you know that it's not really what you mean and you are the one caring to these patients. So, once again, if you need to call somebody to help you out, then never hesitate. Cultural differences is such a big deal because we nurses could be working in different countries. Sometimes some of us we like to explore, and as well as the laws, the policies in every country could be different. So beware of that. Otherwise, when you know about good communication and you're really keen to that, you're really a good communicator, then everything can be manageable and negotiated. Adapt communication styles. Adjust your communication style to meet the needs of diverse patients and colleagues. So, like for example, I used to work in the Middle East in Saudi Arabia, and they have hugely uh, differences of communication other than the language itself, though. Even the nonverbal communications, they have differences, different impacts to normal Asians like me and to them. Good to them. I mean, it could be like 50-50 to me. It could be good or bad. I couldn't trust this nonverbal communication, but otherwise, it's nothing bad at all. It's the differences. And there is nothing bad. There's nothing wrong with the differences as long as the intention is right, is true. It's just the differences of culture. That is why, even though we have differences, and we meet those differences by taking care of patients coming from different parts of the world, we got to be careful in dealing with these people. And by the time that we get what what they mean, that's the start of the relationship. You build rapport, you build trust, and it's easy to give patient care when you trust each other. When you build trust to the patient, when they trust, of course, when they trust you, it'll be easier for them to do the things they you want them to do. You requested them to do by doctor's order. You know, you always want what's good for them, and it's easier also to implement high nursing standards, and that will lead them for a fast recovery. So that's how important it is good communication skills. Number 6, feedback and reflection. So seek feedbacks about your communication. Ask your colleagues and patients for feedback on your communication skills. Reflect on interactions. So reflect on your communication experiences to identify areas for improvement. Like for example, my personal experience before when I used to work in the Philippines. So I first year of my work experience, I talked to patients in a way that I talk to my friends, but not to the point that in the disrespectful manner. But some of my colleagues are telling me that this should be the way. You are too easy to them. You have to be strict sometimes to this type of patients so that they can say yes to you, and we can give an effective patient care to them. We have to achieve a good communication skills in a way that we have to be tough on them, like tough love. You have to be strict on them. That is for their own good, and I've learned that from my colleagues from the Philippines in the first place. And as well as respect. People are different, so you got to always basically respect them, just like our loved ones. Respect, and then as you build trust and rapport with these people, with these patients, then you can learn to love them in their own way. Love them as a nurse, professionally, so that don't come across from that, right? So you will learn to appreciate the different people with different personalities, different attributes, different way of communication. So when you learn that by means of active communication, you will also going to come up with the idea that people are totally unique. And once you make mistakes, though, like you encounter misunderstanding with your colleagues, with the patients, sometimes things could go wrong in terms of communication. Once again, don't hesitate to call somebody to help you out with that, because there has to be a continuity of care. That is why people are working there in the healthcare institution for continuity of care to deliver effective patient care so that they can recover and they can go on with their lives. We don't focus only to ourselves. We also it's important to be strong enough to ourselves, to manage ourselves, to carry ourselves well, so that we can deliver an effective patient care. So if you make mistakes, and me too, it happens to me, wherein I encounter some misunderstandings with my colleagues and some patients. It does happens, but you have to make sure that the care is still there. And when you both finally come down, then that's the perfect time to reconcile, to talk about it, to solve the problem before you go home. Whether it could be, misunderstanding with your colleague or with the patients, no hard feelings. Always reconcile and solve the problem. It's not the end of the world anyway. When somebody dislikes you for the reason of just misunderstanding, you can always do something about it by means of good communication. So reflect on those experiences wherein you encountered conflicts, so you can improve, you can get better over time, and you can also handle yourself the next time around when you encounter these types of people. Number 7, continuing education and training. So there could be workshops and courses to focus on communication skills. So you might be interested to join those courses. And in those courses, they will also portray some sort of role playing exercises wherein healthcare providers can engage in role playing scenarios to practice and improve communication techniques. Or even with your friends, though, if if you have some doubts, they're gonna help you out. Even even in terms of role playing, if they are your good friends, they will make you feel that you are important. That you They will make you feel that you have to really learn the lesson about your queries so that you can improve yourself the next time around, and as well as your communication skills. Now, effective communication is important in patient care and team dynamics because, you know, in term like in patient care, speaking about the patient care, the way when you can effectively implement the right care for patient, it actually improves their outcome. Effective communication ensures patients' understanding on their diagnosis, on the treatment options, as well as care plans, and it will lead them to a better adherence and outcomes. So when you are good together, patient and nurse, working together, and the patients are cooperative to you and even attentive, and you can give the appropriate care to your patients, it can lead them to fast recovery and even keep them safe. And once you have a good relationship with the patients by means of good communication or effective communication, it enhances patient satisfaction. Clear and compassionate communication can improve patient satisfaction by making them feel valued and understood. The reason why patients are in the hospital because they're sick and some other problems could be personal problems. And when you are there caring for them and they feel understood, that's already a good score, not only for you, but for them in terms of their recovery. And that is absolutely important. Help them recover and go on with their life so that they can do what they have to do. They might have some missions in life, so help them out. And also, when patient and nurses are good together because of effective communication, they both have trust and rapport. It reduces error. Accurate and clear communication minimizes the risk of misunderstandings and errors in the patient care. And in the most part, though, as I've mentioned before, trust and rapport is important because it encourages patients to share vital information, aiding in accurate diagnosis and treatment. So when the patients trust you, you're going to know how they feel. They're going to give you feedback about your care. They're going to let you know how they feel about your care. They would even appreciate you or even admire you. Some patients, those teenagers, you might gonna inspire them to become a nurse someday, which actually happens. This was your patient before, and then after 10 years time, you just happen to know that they're now your colleagues. They go to school to become a nurse, and you could be one of the contributing factor of that decisions that they made. You inspire them. And in terms of team dynamics, though, when the team has good communication skills, when they trust each other, it's easy to collaborate. And that actually promotes a collaborative environment where team members can work together effectively and efficiently. You're going to finish your job fast, and the quality of your work is based on high standards. What more could you ask for when you are working with a team where you can be happy, be yourself, and you can make your patients happy? So that's how important is good communication. And also, when you know how to talk it out, your feelings as a team member, but for the sake of teamwork, though, it also Now, good communication skills also is essential for resolving conflicts and misunderstandings among team members. So, yeah, when you have problem with your colleagues, then you can talk things out. No resentment, no anger that will be brought at home, because it's easier to solve it while you're working within your shift. And that leads to strengthened strong relationship with your team members, teammates. And when you have good communication, it's easier to share knowledge. Open and transparent communication facilitates the sharing of knowledge and best practices, enhancing team performance. So when you have good teamwork, it's easier for you to improve the quality of care that you're giving. If it's important, if you have suggestions, you're going to get an answer. You're going to get a yes or a no for your suggestion, and you understand why, in terms of patient care in your area. And when you have good communication with your teammates, it promotes a supportive environment. A culture of good communication creates a supportive environment where team members can feel heard, valued, boosting moral and job satisfaction. So as I've mentioned before, what a life when you work with good teammates, wherein you can verbalize your feelings, your thoughts, your ideas easily. You can be heard, you can be valued. You wouldn't think about going to transferring to another institutions. You most probably, or you would likely to have a probability of staying in that area as long as you like, or it could be in the longest time. That's how important is effective communication. And that even leads to trust and rapport with your colleagues, and even love them as your colleagues. It even leads to a relationship outside work. You might gonna find your best friend there. But when you work, it has to be a professional relationship. No hard feeling at work. But you could be best friend outside work. So there's also a right place for a different relationship. Now, effective communication is a cornerstone in nursing practice. Otherwise, if we have the best care in the world, but we couldn't deliver it to patients effectively, it wouldn't make sense though. That is why communication is the key, because it significantly impacts patient care and team dynamics. Now, by providing communication skills, nurses can ensure better patient outcomes, foster a positive work environment, and enhance healthcare delivery. And that leads to happy life for everybody, for the patients, for your colleagues, and most importantly, to yourself. You go home happy almost every day. Although life isn't perfect, but there's always an opportunity to grow, to get better every day. So if you ever love this episode today, you can share this to your family and friends. You can follow me in Facebook, YouTube, Spotify, Apple Podcasts, and on Amazon Podcasts. This is Anne of Reinforcement Club, by the way, your fellow positive reinforcer. I do appreciate your time and have a lovely day ahead. Thank you once again. Bye.